Let's roll out another episode of Flip the Script. And again, I'm Dr. J. Joey here with my good buddy Cameron, and we're going to pick up on part 2 of what we talked about last week, which was cardiovascular disease. Because it's the number one cause of mortality in our country. And we wanted to touch on our opinion on that, which is basically we're dealing with an inflammatory disease. Okay? So inflammation is the key, and we want to talk a little bit more about how we get that inflammation under control. And because there's quite a bit of information, I'm going to try to stay on spot. I'm going to use a couple of little cheat sheets here just so I don't, you know me, when I start rambling, man, I can go. So this is going to kind of keep me out of an hour and a half presentation today, right? So where we left off last time, we talked about that B vitamin, thiamine, and the B4 and its relationship to heart rhythm and the importance of that for controlling the AFib, arrhythmias, things like that. So today we want to talk with the component of the inflammation. And when we talk inflammation, we've got to think essential fatty acids, the EPA and the DHEA. All right, I'm sorry, DHA, not DHEA. That's a hormone. Again, caffeine slowing me down. So the essential fatty acids, think fish oils, flaxseed oil, and of course a beautiful natural source of that would be grass-fed beef, animals, meat. And the key thing with the essential fatty acids, they help to lower triglycerides, which, in my opinion, forget about any total cholesterol. The triglycerides and their relationship over the HDLs, that's your true marker of metabolic syndrome. Metabolic syndrome, that's your key factor in preventing inflammation for cardiovascular disease, in my opinion, and a lot of the really good research that's been coming out lately. So your essential fatty acids lowers triglycerides. And another key component, which you never hear about, which is the protein clotting factor in the blood known as fibrinogen. So we're going to dive into that a little bit more in detail here in a little bit as well. So think about it. If I'm decreasing that inflammatory condition and I'm reducing the inflammatory protein within the blood, is that not going to help with high blood pressure, right? So again, reducing blood pressure. And for years now, my patients with high doses of essential fatty acids, fish oils, it's their go-to for arrhythmias, sensations of the heart. So again, why? Because, well, we're reducing inflammation and we're improving insulin sensitivity. So if I'm improving insulin sensitivity and the side effects of insulin sensitivity, which of course is the obesity, the weight gain, all these signs of the metabolic disorder to start with, okay, our syndrome X as we know it. So that's the importance of that. Key here is that the essential fatty acid, you have a lot of anti-inflammatories out there, and they'll work on, what we know of as the prostaglandins. The beautiful thing about the fish oil, they go deeper. They go into the eosinophils. So you can't actually find a more powerful anti-inflammatory at the cellular level. So, fish oils, and the key with fish oils here is that a lot of times people think these high doses are the best. And super high doses, sometimes, they go through excessive filtering and watering down process. So I personally don't use super high doses of EPA and DHA. I want a good quality triglyceride form, which is kind of funny because we're talking triglyceride form, that's more of your pure fish oil. And the triglyceride form does just that, lowers the triglycerides the best. Okay, so that's what I'm looking for when I'm out with looking for a quality essential fatty acid, quality fish oil. And that's why really, look, my favorite cod liver oil. I got the EPA, I got the DHA, I got the vitamin A in there. I've got the vitamin D in there as well. So for me, that's sort of my go-to on omega-3 fatty acids. The next one, that vitamin E, our friend vitamin E. And when I'm talking vitamin E here, people, as we mentioned with you, I'm not talking what you buy in most of these stores in the vitamin section, alpha tocopherol. Alpha tocopherol is it's the antioxidant component of vitamin E. It's what they are able to isolate, and sadly, that's what they sell. I'll give you another example real quick. They did a test on cardiovascular health and vitamin E. The pharmaceuticals did this about 10 plus years ago. What did they use? Only alpha tocopherol. So when they used just an isolate, they got negative results, which was expected because they didn't use the whole vitamin complex. So you think this was premeditated? I'm going to say you bet your butt. This way, they can come out and say, we did studies on vitamin E, no correlation between that and cardiovascular health. They didn't use whole food vitamin E in the study. They used the isolate alpha tocopherol. So I want you to think of it like this. This is like going to your favorite car dealership, boom, for that dream ride that you've been wanting for quite some time. Put your money down, they bring you out 4 tires and go, here's your vehicle, right? It's like, wait a minute, man, that's not what I paid for. Alpha tocopherol is not what you pay for when you go after vitamin E. So if you see it on the label, just drop it, go, all right? There's 7 tocophenols in vitamin E. Give me the whole picture. And not only that, in nature, when you find something with vitamin E in it, whether it's a pea vine, I don't care, green leafy vegetable, you're going to have the selenium, you're going to have the other synergistic fat-soluble vitamins are found in the plant naturally as they come. So you got your vitamin A, you got your vitamin K, you got your vitamin D in there. They're all part of the natural food, which is the way our bodies know to use it. So, again, also with vitamin E, ladies, anything skin related, all right? Even, what's really interesting with that is even acne is actually a vitamin E deficiency that occurs in the youth. And how this works, which is that the body is basically, vitamin E is a precursor to all sex hormones. So as the youth are going through this rampant upshot of sex hormones in their late teens, this vitamin E is being used up for that, and guess what? Now it's not there to protect the skin from acne. Pretty cool connection.
What's your favorite supplement for vitamin E?
Well, when I'm looking for vitamin E, I just think green leafies.
So you're
because that's basically
complete.
it. Well, I now if I'm going to supplement with a vitamin E supplement, I'm going to want a whole food source of that E. Wheat germ being a great one. All right, wheat germ, boom, it's the germ. Those nutrients are in now.
Oh, that wheat germ oil?
Wheat germ oil, standard process wheat germ oil is my favorite.
Okay.
People, you can't go and buy the wheat germ you sprinkle on the food and get the same effect. A mentor of mine used to use that when he was in his 70s. He used to, down in Florida, for exercise, he rode his bike miles and miles a day. And what he would do is he'd set out for his course. I think he had a 5-mile loop. And at 2.5 miles, he'd pop a couple of wheat germ to sustain energy for the rest of his trip. So, again, you want a little shot in the arm, so to say. There you go. Which is vitamin E, which is increases oxygen utilization, right? And so Rod Stewart has a song that came out in the 1980s, Hot Legs, right? And he mentions in the song, he says, I'm going to need a shot of, as they say over in England, vitamin E. by the time she's finished with me. And I kind of laugh when I hear that. And I'm thinking, I know what you're talking about, brother. But vitamin E, also important for anything connective tissue. Think ligaments, tendons. And that's why we were talking about the mitral valve prolapse, right? The heart's a muscle. So, if this muscle doesn't have the adequate B to hold the strength, and you got this vitamin E for the tendons, which basically is what your valves are, well, it gets out of balance. And, of course, then that valve doesn't close properly. And here's your mitral valve issue associated with what? Again, B vitamin, vitamin E, nutritional deficiency, right? So this is why I think all support of cardiovascular health, vitamin E. So with that, we can talk about vitamin C doing the same thing again. Because most of the time when we're buying vitamin C in a store, or these store-bought vitamins, should I say, look on the label. And when you see ascorbic acid, people, again, they're just selling you a part. And actually, it's 5% of that vitamin C complex.
Oh,
So you're getting ripped off. It's the antioxidant. It protects everything inside of it. But man can isolate it, so this is what they sell us, and then they tell us this is vitamin C. What's going to happen if you continue to take that? How about vitamin C deficiency? That's why I say, we don't really have the scurvy as we know it hundreds of years ago. But in a sense, we're all running with this subclinical scurvy today due to deficiency in vitamin C because they're throwing the ascorbic acid at us, right? So, what were you going to ask
well,
me?
anything that says, any vitamin bottle that says like vitamin whatever, and then in parentheses says as something else, that probably means it's your body can't absorb
That's
it, right?
It's an isolate.
Right.
And you'll see this for for medicinal purposes in some high dose therapies where, where they're putting into the system directly, venous wise, right? And that's more for, and the oxidation is actually what vitamin C, ascorbic acid, we call it an antioxidant, but studies show that it causes oxidation. So some of these therapies where, again, like I said, they're using super high 10, 20, 30. Lyme's disease is an example of that. It does have its medicinal purposes at that high level. Side effects, diarrhea, stomach irritation, complications associated with that. But for the average Joe, all right, that's not what comes in the orange. That's not what comes in the red pepper. Anything with high sources of vitamin C. It's not the ascorbic acid again. They're not ripping us off in nature. Everything in nature is going to come with the full capacity. And then you have the other things in vitamin C with the P factor, known as that it helps prevent or increases your vascular integrity. So when I see somebody who bruises easily, or I see somebody with spider veins, varicose, I know that they have an issue of vitamin C deficiency, specifically that P factor known as rutin within the vitamin C. You're not getting this with ascorbic acid. So a lot of times, some of these MDs, who, especially these who specialize in skin-related issues, dermatologists, they'll say, oh, yeah, there's no correlation between vitamins. No, the way they know it, they're not wrong here because they're talking ascorbic acid, not vitamin C. So any healing aspect, I don't care, arteries, inflammation of any kind, immune system issues. And so when you think immune system, you also got to think adrenals. Adrenals have to have vitamin C in order to function properly. And they have to have the oxygen. And what is another great oxygen carrying component for the body? Vitamin E and vitamin C. So again, this is one of those must have when we're looking for cardiovascular health as well, right? There's another sign of vitamin C. What's really kind of cool with this is that people who find themselves air hunger, we call it, they're always gasping for that, out in the middle of nowhere, that breath. And another real interesting one is people who get in a car or in a room and they have to open a window. That's also a little pearl, clinical sign of the possibility of oxygen deprivation or, a need for vitamin C.
So you're saying about the bruising from the lack of vitamin C, right?
The P factor within the vitamin C, but yes, but so again, we're talking the whole food vitamin C.
Does that have anything to do with iron? My buddy, I know, he was like, dude, I bruise easily because he did jiu-jitsu. He's like, dude, I bruise way easier than I should. I think I have low iron or something. how would he know if it's low iron versus? Or is
Well,
there
it
any
doesn't mean he
correlation
doesn't
between
have
the two?
low iron. He could possibly have low iron as well, right?
But
then
wouldn't he be
again,
really tired if he had low iron too, though?
yes, well, yes.
Because he has fine energy
And hey,
levels.
you know, you can be tired with low vitamin C as well. Because remember, again, it's the oxygen utilization. And if we're not maximizing the utilization of oxygen, we fatigue easier. So good point. So yes, that and anemia, in a sense, yeah, one is possibly, if you have one, the high probability, you have the other as well, right?
Okay.
Like we were just talking about, the adrenal fatigue, right? So if I have adrenal fatigue, again, what am I going to wind up usually with? Elevated cortisol. And what's cortisol? Probably the most inflammatory marker that you're going to find, and we're going to talk about that here in just a second, in the body. So boom, a cascading domino effect? Absolutely, which is what I'm going to get to here in a bit. So you see what we're dealing with cardiovascular disease? Are we not dealing with a deficiency of nutrition? Right? The number one killer in our country, which is why the podcast today. We're going to dabble a little bit more, though, because that's a good question, brother, and it all connects. Then we got this herb called hawthorn berry, and this hawthorn has always been called the the heart herb. Try to say that fast. And these two components, this helps to increase or decrease, if you will, the oxygen requirement necessary for the heart. So very good herb for taking the stress off the heart. It increases the circulation to the peripheries, which means, you know, away from the body. So if I'm increasing oxygen carrying capability away from the heart, less work for the heart to push that out. So hawthorn. So it's also another one of those, again, like vitamin C and vitamin E, a powerful antioxidant. Been around since, gosh. Well, certainly, you know, Eastern medicine, poplar. And we can't forget our friend CoQ10. All right. CoQ10 is that fat-soluble antioxidant. This is known as this is what feeds the energy to the body. Coenzyme Q10. It's found anywhere you're going to find the mitochondria. The mitochondria are found where? In the areas of the body that need the most energy. This is their food. The areas like the brain, the heart, large muscles, the legs, the back. These are loaded with mitochondria. These need high levels of CoQ10. So, cardiovascular, heart, right? What are we talking about? CoQ10, necessary. So what drug out there that is probably the Mac Daddy for all cardiovascular disease, which would be your infamous statin cholesterol-lowering drug? What does that block absorption of? CoQ10. So if I'm blocking CoQ10 from the mitochondria, I have fatigue. Makes sense? What's the side effect of that? Well, if it's in the brain, it's called dementia. If it's in the muscles of the body, it's called low energy. Now, at the same time, CoQ10 is necessary. Basically, the enzyme that produces that enzyme is part of the detoxification from phase 1 to phase 2, like we talked about in the liver detox podcast that we did. Coenzyme I reductase. Statins block that, which is necessary for the conversion to CoQ10. So here I am using this drug hypothetical for heart health and cardiovascular that's causing the depletion of the primary source of all energy for the heart, which is why if you are on a statin drug, my patients, it's almost mandatory, if you will. You have to supplement with CoQ10. And doctors know this for the most part, so why doesn't your doctor just tell you with that prescription, go get you some CoQ10 to go along with this 200 milligrams minimum? It's the same thing with fish oils. You know, over in Europe, it's almost neglect if you have a patient with a cardiovascular issue and you're not telling this patient to get on some form of essential fatty acid. Sadly, in this country, it's sort of above most of the doctors because what? You don't need a prescription for essential fatty acids, right? And you don't need a prescription for CoQ10. So sometimes it's just not in their wheelhouse to recommend it, sadly. So food sources for that, again, organ meats, loaded with CoQ10, fish, nuts, another very good source of CoQ10. So get CoQ10 in the diet. And people on statin drugs, I tell you, especially when I put my patients on, they're like, holy camole, man, where was this energy at, right? And sadly, the brain is the key point, which is one of the major side effects of statin drug use is going to be losing my mind, doc. Dementia. So if I had to sum it up this way, let's say this. Cardiovascular disease, if you had to pinpoint it, it's an inflammatory disease of the body. Inflammatory disease primarily to the vascular system. So, like I was telling you earlier, we want to look for signs of inflammation to the system. And the most sensitive sign is going to be your C-reactive protein. Homocysteine. Elevated homocysteine, that's a sign that you have inflammation into the vascular system and the arteries. This is what causes the damage to the vascular system. Once the damage occurs, then I had things like cholesterol that come along and can create the plaquing, right? But this is like an afterthought. It's item 10 downstream. Homocysteine, C-reactive protein. The other one, we were talking about the fibrinogen, that clotting factor for the blood, okay, elevation of the fibrinogen. Trust me on this. Your doctors are not going to ask for this on a CBC blood workup. You're going to have to ask for it, all right? And another one, in my opinion, another major marker of cardiovascular disease is uric acid levels. Again, most physicians aren't going to recommend. You have to ask for this. Why? Well, because here's why. And let me get back with uric acid real quick. Sign of uric acid, anybody with a high uric acid level, that's your sign of gout. And ask somebody with gout what that inflammation feels like, all right? It's painful. So like I say, if you have the gout and you got this big shiny toe or this knee that's gone from red hot to white hot, what's going on the inside? We can see that on the outside, and you feel it on the outside, right? Gout. And don't go with the drugs for treating gout. What's the side effect of it? If you watch the commercial, gout. So again, think uric acid, and one of my favorite components for that is phosphorus. But anyway, getting back, so here's 4 primary markers that aren't normally studied. You have to ask for it. Why? Well, because again, we're looking at homocysteine, C-reactive protein. We're looking at primarily B vitamin deficiencies, right? B6, folate, B12. So if these are nutritional, and most of your physicians in the medical profession get less than 1% of their education in nutrition, well, then they're not typically going to go there. So if you said, Doc, I got this elevated homocysteine, how do I treat it? Well, right? Because that would require a vitamin primarily. So they're not likely to jump into something they don't know, and you really don't want advice from somebody who really isn't educated in that anyway, right? So you're going to have to ask for these. Demand them if you have to, okay? Because these are the key markers that tell you you have something going on cardiovascular-wise. It's the most beautiful thing, and again, they are a condition associated with a deficiency. We give that deficiency to the body, boom, we reverse that particular ailment, if you will. So, again, when I'm talking B vitamins, though, and I say this B6, and I talk about this folate and this B12, you're not going to find these in isolation. You're going to go store-bought vitamins, not going to do that, right? These are isolates. You need whole food-based vitamins. Again, organic, right? Something that the body knows what the heck to do with. So, again, like I said, CVD, cardiovascular disease, think of it as an inflammatory disease. And we talked about the uric acid there, and that being the key component. So if you're going to control that, always, like I said, essential fatty acids is a key place to start. Your fish oils, your flaxseed, your cod liver. reduce the inflammation. There's the key. Your B vitamins, again, we talked about, again, not just the isolates. And to simply, as our society does, treat the symptoms of cardiovascular disease with these medications, we're basically, in a sense, what we're doing is we're putting the blame for this cardiovascular disease on the heart for a crime that it didn't commit. It's everything outside that are affecting the heart, and we're treating the heart. So, again, so many of these blood pressure and these other cholesterol-lowering drugs, the side effects, in a sense, life-defying side effects of these, with the total fatigue, just the quality of life diminished, which is why a lot of people, the majority of people, really have a tough time staying on on blood pressure-related blood pressure medications, again, because the side effects are so bad. And with this, this is why, I get in my clinic people coming in and saying, hey, doc, you got to get me off of all these medications, right? And you see where it's not as easy as just coming off of them. We got to get that deficiency back in. And the sad truth is, with a lot of these cases, you have to work with their primary physician, because you can't just come off of some of these meds cold turkey, especially these blood thinners. They're very dangerous, right? So you have to work with the primary, and same thing with some of these blood pressures. Some of these things, you've got to build up the deficiency, especially these beta blockers, before you just cold turkey come off of them, right? So it's doable, but you need teamwork. So that's where I really kind of wanted to go with this whole issue, cardiovascular disease. And let's go back to the legendary Dr. Royal Lee called out cardiovascular disease for what it truly is. Not yet. It's a 80-plus-year-old disease of bleached flour and processed food disease of malnutrition. Basically, that's what we're dealing with, malnutrition here. This spawned the sick care system that we're in, and the pharmaceutical dynasty with drugs that are designed to punish our heart for a crime, like I said earlier, that it didn't commit, right? Drugs for lowering blood pressure, drugs for lowering cholesterol, and drugs for lowering our very life source, which is our blood, right? And Americans bought into this approach, hook, line, and sinker. It's another, we always talk about, Cameron, it's another metabolic issue. Always has been. And there's no drug today, and most likely there never will be, for correcting bad foods and bad lifestyle choices. So, if you would, on that one, let's end this podcast, or this discussion, if you will, with this. Let's end it with a question. And that is, could it not be said that cardiovascular disease is not really a disease at all with what we're presenting today? Could it simply be a cardiovascular deficiency, a cardiovascular metabolic deficiency, which one that could surely be reversed, eliminated, possibly eradicated? So how can a lifestyle-related disease claim the top spot on the list of humanity's demise in the good old U.S. of A? Think about that one. Ponder on that until next time, because, wow, again, we got time restraints, we try to keep these simple, short, quick. So, anything else you want to cover, brother?
At the beginning of the video, at the bottom right, there's a button. If you hit that, that's a subscribe button. That would help us out greatly. And then if you are looking for any guidance on supplementation or anything, where can they reach you?
Well, at my website, www.drjoeyjones.com. And
is that DR or DOC?
Yeah, Dr. Joey Jones. Dr. Joey Jones, www.drjoeyjones.com, or also at my clinic website, which is info@drjoeyjones.com. Okay. Yeah, and like we talked about earlier, if you're interested in some of my recommended supplements for these issues that we talk about, I would be more than glad to give you information where you can find those wherever you are. So good point there, brother. And yes, please don't hesitate to hit that like button if you would, and we'll sign out for now. So as always, have yourself a blessed day so that
you're not missing one.
Thank you, brother.